So here we are in April of 2022, and I just wanted to go over a few highlights, if you will, kind of like a PVH State of the Union before we get started. And let's see if my computer is working today. There we go. So we're going to just really start off with continue what we've been doing in the past, is having those 1-minute introductions. What I've been seeing, and I think you have too, is this gets us all together and we get to meet people that don't live in our backyard. So we started off a few months ago doing the early alphabet, and now we're on to K and O, and we'll start that in just a minute. And what I've seen from this is I get emails after, hey, I met this person online, can you connect me with them? So it's just a way for us all to introduce ourselves to each other and see if there's anything that we can work together on. And then we are going to have some breakout sessions where we're going to, and we did that last time, and I saw a lot of conversation going in the different groups, just in that smaller group setting. So we'll spend the majority of our time today on those breakout sessions. And I didn't pre-assign because what I did is just set them up. And so just like last time, you'll be able to choose. And if you've changed your mind from when you signed up, that'll be fine as well. So that's basically our agenda for today. And then at the end, we'll gather and be able to give any updates for everyone that would like to share. Just to remind you, you can find the recordings on cpsboard.org/heatstroke, and the past recordings in this one will be posted there. And Ron Kramer from National Safety Council is very good at getting that up very shortly after the meeting. So please feel free to look at that and also to share. And if there's anyone that you feel that should be invited that we're missing that would have a stake in this group, we would love to have this group be expanded. So please have them contact us and we can make sure they get on the distribution list. So to get started, and I think I counted from the registration about 8 people who have the last name starting with K through O, and really just doing this to begin that collaboration and partnership ability. So if your last name starts with the K to O, and don't all fight to go first, just tell us a little about yourself briefly, about 1 minute, your role, your PVH background, your activities, and if you have a countermeasure interest, or maybe perhaps it's all. But I don't know who would like to go first. I have some names written down. Don't make me call on you. So I will turn off my my microphone and let someone else take over. So please, let's get to know each other.
Hi, Jess, I'll go first since I'm a K. Hi, everyone, it's Kristen Kingsley. Thank you, Jessica and Safety Council, for hosting this awesome group. I think it's been really great engagement over the last several months. I've been working in auto safety for more than 20 years. I'm a mechanical engineer and I specialize in crash avoidance technologies. I started my career at NHTSA. I spent 15 years there, where I started in crash investigation and real world data collection and analysis, and then transitioned into vehicle safety research and then into policy. For the last 5 years or so, I've been working for the auto industry. I'm here as a consultant representing the Alliance for Automotive Innovation, who, for those who don't know, is a trade association that represents original equipment manufacturers, suppliers, and technology developers. And many of you may be aware, there was a voluntary agreement to equip vehicles with rear seat reminder systems in an attempt to help prevent the tragedy of pediatric vehicular heat stroke. In addition to that, the Alliance and industry partners are very interested in communication about this issue, educating the public, but also, and important from our point of view and our perspective, is helping folks understand the risks, but also the technology that's available out there. We have a lot of difficulty with new technology and getting people to embrace it, understand it, especially if it's not implemented well. False positives can have a very negative effect. And so we have the combination of the technology development as well as the public education piece about the technology. So That's it. Thanks so much to all of you for your participation and your contributions. This is a very important issue, really heartbreaking, obviously. And if we could prevent this from happening in the future, I'll do whatever I can to help.
Thank you, Kristen.
So I'll go ahead and go next.
Thank you, Jan.
I'm Jan Null. I'm a certified consulting meteorologist and an adjunct professor of meteorology at San Jose State, formerly a National Weather Service forecaster for 24 years. I became involved with the topic of pediatric vehicular heat stroke in 2001 after the death of a child in the San Francisco Bay Area. Did research in the way that cars heat up, how rapidly they heat up, how hot they get. And that was eventually published in by the American Academy of Pediatrics in 2005. And then that has sort of melded me on into the child safety community that we see so well represented here. And I've sort of encapsulated a lot of that into a website, which I try and maintain in almost real time, called noheatstroke.org, for tracking cases, for data about how hot cars get. And that's out there as a toolbox for all of you to use for your various efforts, both looking at temperatures and also looking at the epidemiology of how, sadly, how often that these cases happen. So great being with this group.
Thank you, Jan. Do we have anyone else who'd like to go?
I can go next. Hey everyone, this is Jalaj Maheshwari. I'm a research project engineer at the Center for Injury Research and Prevention at the Children's Hospital of Philadelphia. I've been involved in automotive safety, in different aspects of automotive safety for a while now, but our center has conducted extensive research on heat stroke related technologies in the past. I've undertaken some projects around heat stroke cases that occur in the real world, trying to assess what are the different types of detection and alerting unique types of cases that can arise, what are the and basically work with the automotive industry, which includes vehicle manufacturers, child seat manufacturers, government affairs and consumer information companies to try and solve this problem. So my interest in this group and in heat stroke particularly is to how do we prevent these measures through adoption of technology and through behavioral changes.
Thank you very much. It's a combination of both that technology and education. Appreciate it.
Okay, I'll go next. And Jessica, I'm just going to say it might be easier on our end if you would just call on us. But it's tough to jump in. But I'm Bonnie Koziel at the American Academy of Pediatrics. I work with our Council on Injury, Violence, and Poison Prevention, which is the group that writes our recommendations for all aspects of child passenger safety and injury prevention in vehicles relevant to kids. We, have been working on this through our various channels for a very long time. I've been at the Academy for over 21 years and have been doing injury prevention for almost 18 of those. And I think it was one of the earliest topics that came up that we hadn't done anything about yet in my tenure. So we have public education pieces, and we do a lot of advocacy around all kinds of transportation safety priorities. But certainly, I believe this was heat stroke prevention was called out in our package of priorities for kids that were provided to all of the various departments of the federal government when the administration changed over in 2021. And so we come at it from the education side because our audience is largely pediatricians and parents, but our advocacy arm also does a lot of work in this space.
Thank you, Bonnie. And thanks to the group for being so helpful and jumping in. I appreciate it. All right, we may have a few more. Anyone else would like to go?
I will go. So my name is Lily Muller. I am currently a undergrad at Penn State in meteorology, and I'm going to be a haulings intern at National Weather Service Louisville. And my project is going to be like how to improve messaging for heat-related deaths. So I don't have too much background yet. I've just kind of started learning in the past few months, kind of more about this topic and kind of the measures that are already in place. So yeah.
Welcome. It's very exciting to hear somebody just getting started and coming into it. So hopefully taking the background of this group and then injecting new information and making those messages being effective and improved upon. So thank you very much.
I can go next. Hi, everybody. I'm Sam Mishra. I am the EMS for Children coordinator for the state of Michigan, and by training clinically, I'm an emergency physician. On this group, I'm representing NSEMSO asked me to participate in the NHTSA Heatstroke Partnership Work Group, which is how I met all of you, of course. I do serve on the NSEMSO PEC Council and the Safe Transport of Children Committee. In my role as EMS for Children coordinator, I've just really taken a passion with injury and fatality prevention with pediatrics. So at the state level, I also work with our HHS divisions for injury prevention, specifically surrounding vehicles and keeping kids safe.
Thank you very much. Go Michigan.
Go green.
I am a Go Green. I was just like, give it a plug for this state.
Oh, cool. Yeah.
I'm totally a Spartan too.
Awesome.
So we're good. Thank you. Is there anyone else as we wrap up these introductions so we can get started into what you're all here for, which is our discussion?
Hey, Jessica, I'm sorry, I missed my last name category because I signed on a bit late. I'm Tara Gill with Advocates for Highway and Auto Safety. We're a nonprofit traffic safety organization located in Washington, D.C. We work on the federal and state legislative and the federal regulatory level, focusing on, safe road users, safe vehicles, and safe roads. I think our focus on this issue, we absolutely support education to reduce the incidents, but given that research has shown it's largely an issue of distraction, we think it's time to move into a vehicle safety technology component as standard equipment in all vehicles, because no parent ever thinks they're going to inadvertently leave their child in a vehicle. And so that's our focus on this issue.
Thank you, Tara.
Absolutely.
Thanks for joining us today. And for those who perhaps we haven't gotten to, don't worry, we're going to continue these brief introductions in the next few meetings as well. So we won't forget about you. We can make exceptions for if your last name falls out of those categories, but I wanted to move on so we can get into our breakout sessions. But before we do that, I just have a few things I'd like to cover with the group, kind of like I said at the beginning, a PVH kind of state of the union, like where we're at right now, just to get to some points in our minds as we go into our breakout sessions. And I want to thank Jan Null and his group at noheatstroke.org, not gov, excuse me, .org. And those are the charts that you're seeing there. So here we are in April of 2022. So we are fortunate in the fact that there have been 0 fatalities for PVH in the year 22, because you can see that from the graph on top. But when we kind of look over the past few years, in 21, there were 23, in 20, there were 25, and in 19, there were 53. So we have a total of 906 starting from 1998, and on average about 38. So when I'm taking a look at this, and I'm sure a lot of you are as well, is what's changing right now. And in April, we have a lot of changes going on. In my community, we have a lot of members who are going back to the office. So their routine is changing, and we talk about routine and distraction. So their past 2 years, their life has looked different in their commutes, in their day, in their daycare. That was perfectly timed. Thank you. Also, their school schedules have changed and their office schedule has changed. And we've also have new parents and caregivers who haven't had to think about the routine and their children being introduced. So we have all these changes, and we look at the past 2 years and that drop. And I'm not saying that I have the background in saying that's why they stopped, but we have a lot to, and when we're looking at 22, things are changing and we need to be cognizant of it and aware. And I think everyone on this call is, but I just wanted to bring that to our forefront of our mind, all these changes that are going on right now. And then we also look at April down in the chart below. That's when you really start to see the numbers start to creep up. When you see the max and the minimums and the average start to creep up. And just because we're not, or I live in Michigan, it is not, as you know, it is not that warm yet here in the Midwest. However, if we're planning to do our outreach, or if you're planning to do your campaigns, now is really the time to start getting that message out, if not constantly, but you know, everyone has that lack of it, or only so much ability to pay attention to something for a while. But when we look at when this happens, April seems to a lot of us is the month that we really need to start ramping up everything. So I just wanted to touch on that again. And I want to thank Kristen Kingsley also for starting that talk discussion. That was something I was looking at yesterday. That memorandum, it's a word I can't say, of understanding, that MOU that came out in 2019 from the Auto Alliance. And I know some of that group has changed and kind of has been repackaged, but I'm looking forward, and I think as a group, we should be expecting to look at, or to make sure that we're aware, the report that is expected in October of this year. And that MOU stated that 95% of model year 25 vehicles, that was the goal, would at least have that door logic in that system, and that really is of no cost to manufacture. So you're going to be seeing that, and that report's going to give us some information on their success. And what I'm seeing and what I'm hearing from other vehicle manufacturers is that they're already there, if they're going to make it, or they're already there. So which is great. Now those radar and those ultrasonic sensors, those are going to cost the manufacturers a lot of or more money. So I know we have some research done on that, and I've seen some presentations from Laurel Glenn. She's been part of this group. I don't know if you're on here, Laurel, today, but those are just some things to keep in mind as we go into this, that report's coming out. So when we talk about the education piece and we talk about the technology piece, we do have that MOU, but we also know that not every parent or caregiver is going to have access to this new technology. But I still love that it's out there and it's coming and it's there and being utilized. So I'm interested to see on how this impacts in helping drive the number to 0 in the PVH fatalities. So that's all I have for you today. Thanks for listening to my little spiel there. I don't know if anyone has any questions or comments, but I think I'm going to go ahead and start the breakout sessions. And if you don't remember which one you chose, it'll just pop up and you get to choose today whether you want to go in the, let me advance the slide here. Bear with me for a minute. The communication, the policy or research, and then just keeping in mind that we're all here to really keep about how to advance our PVH efforts and make sure that we're not missing anything and advance those countermeasures, and really looking at our collective backgrounds and seeing if there's anything that we're missing or anything that we can improve upon, and using our strengths, and then to how that affects the PVH stakeholders in this room. So just kind of setting the landscape for our breakout session. I have a few coworkers who are going to join me in helping kind of document what's going on and help if there's any questions coming up. But if those of you who joined us last time, the breakout sessions worked really well. And I'm going to go ahead and get those started, and they'll just pop up and I'll ask you which room you want to join. And I have them scheduled, it's scheduled for 30 minutes, and in about 60 seconds before that 30 minutes is up, so you don't have to remember how long you've been talking, it'll give you a warning and saying it's taking you back to the main room where you'll see me again. For those of you who choose the policy group, you will see me. I'll join you here in a second. For those with the general research, will be Amy Artuso from National Safety Council. And for those from who choose communication, you'll see Jennifer Bogue from the National Safety Council. And thank you, Amy and Jennifer, for helping out. So, because I don't have to bounce between 3 rooms and just be the floating head that comes in and out. So I'm going to go ahead and start those and let's see what happens here. This is always the fun part. Here we go. Are you guys seeing? Is it working on your end?
Yep, they're popping up.
Yeah.
Thank you. This is always the most stressful part for me, making sure it works. I'm going to stay on until everyone gets into the room that they want. So those of you who are in policy, I will see you shortly.
Okay, well then you're going to deal with me. This is Laurel because I am here and I am trying to join the research and I see the breakout rooms like forming, but I don't see how to join.
Okay, Laurel, you want to research?
Yes.
Okay, I'm going to assign you to research right now, okay?
Okay, thank you.
You're welcome. Amber or Samantha, do you need any help?
Yeah, sorry, I don't see where I'm, I don't have any
That's
options,
okay.
but maybe I could go to utilize collective backgrounds and strengths, please.
Okay, would you like research, communication, or policy?
Communication.
For 100, you are welcome.
Thank you.
You're welcome. Samantha, do you need any help? Oh, just me.
Hello? I see my name, that's it. What? So I go out of that? It's this one. Which one? Oh, I hear something. Recording in process. The upper one.
Hello, everyone.
Gosh, we did not get to finish.
You stole us.
We got thrown back. Let me see. I don't know if we were just thrown back into the main session.
Yeah.
We were
It
in
went-
mid Q&A, Jess.
It went very smoothly last name. What did you say, Amy?
We were in mid Q&A among participants. So we have one unanswered question from our group. But
But I think it's a good question to repeat and have Dr. Diamond answer if everybody wouldn't mind.
yeah.
Yeah, why don't the communication group take a minute or two and do a recap? Or Amy, did you want to go with your group first? Since was that the
Sure. We were research and
okay, thank you.
To Jeanette's point, I'll let Laurel ask her question again so everybody can hear it and then let Dr. Diamond answer it.
And this, kind of goes out into outreach as well and stuff, which was getting information to parents about the issue of leaving children in cars. And coming from Dr. Diamond's background, with the science and delivering that message from him, which gives it this is not necessarily from bad parents. This is how brains work. This is the stress you're under. This is, so it's maybe perhaps more understanding of, oh, this could happen to me because I am under this, instead of I'm not a bad parent. This can't happen to me. So I was wondering what his take was on, versus PSAs or, like things that you have right up or like pamphlets and stuff like that about leaving kids in cars. If he believes that the messaging coming from him or someone like him, doctors, midwives, anyone of that stature, if you can present it in that way, if he feels that that is a better way in having the message received versus the look and lock slogans and things like that.
So what I had started to say was, I'm not against the PSAs. I'm not against educating people because people need to understand that this does happen. Kids are forgotten in cars and they die of heat stroke. And I think the surveys have shown that at least 75 to 80% of the people will flat out say this couldn't happen to me. And of the other 20% or so, they may acknowledge the possibility, but are they going to actually do something about it? And I think it's likely they won't. I think an extremely small percent of people will take action and do something like put their cell phone in the back seat or take something and put it in view, which reminds them that their child is in the car on this particular drive. So while I'm not against educating people, I think it's largely ineffective. Part of the reason why I think it's ineffective is this has to do with human factors. Even the people who think it might happen to them, you get caught up in the stress and lack of sleep when you're taking care of a young child. And even if you're aware of it, it can still happen to you. So that's why I always emphasize we must have laws. And the example I gave was that in Israel, they passed a law after children were forgotten in cars that mandated that daycare centers had to call parents if a child didn't arrive on time. I think we must have very effective technology. I'm completely against the idea that the auto industry gets to do this voluntary development of technology. There must be a mandate, just like there was a mandate for seatbelts. I think we have to take it out of the hands of people voluntarily learning about this and then choosing to do something. So I believe we have to emphasize technology and laws to be able to mandate that these kids are not forgotten in cars. And I gave the example, my wife has been hearing about kids dying in cars for the past 15 years, and she will still say to me, she could never forget her child in a car. And we've got grandchildren. I could never forget my grandchild. So I feel like most people the message will fall on deaf ears. Now, what I also have said before, I'm not an advocate of look before you lock. The idea, and again, maybe I'm misunderstanding it, the idea is you get into the habit of always looking into the back seat before you lock your car. I'm against that because we have some habits that can get us to be able to see something automatically, which ultimately leads us to become blind to something that's not there all the time. So if you look, you actually do look before you lock your car door 500 times, and then there's no child there. On the 501st time, you may have forgotten about the child and the child is actually there. But what will happen is you've got this habit of looking in and moving on and locking, and you're not even aware. You become blind, attentionally blind to the child in the back seat. So I think the habit should be that you have some cue which tells you that your child is in the back seat today. And that cue will remind you to look in the back seat. And it's as simple as putting your cell phone in the back seat or moving something from the car seat to the front that reminds you that the child is in the car on that particular day. So that's my spiel.
Thank you. And then one more quick note, Dr. Schwebel put in the chat, and I agree, just to call out, we also, in addition to these behavioral strategies, need to focus on the work being done by the engineers in our group. But I know we're at time, so I'm going to leave it at that summary for the recording. Thanks.
Thank you, Amy. Thank you, Dr. Diamond. Sounds like there was a lot of good conversation in the research group, and I will follow up and get a few of those highlights and send it out to the group from Amy. So I appreciate that. And the discussion in my group, policy was last time I was in Amy's group that she was leading. So I enjoyed being in a different, we're all here for the same, ultimate goal, but it was interesting to hear from the policy perspective. We talked about vehicle policy. We talked about that MOU that we spoke about at the very beginning, and about the differences in technology of the door logic system and also the detection system, and what that looks like in terms of costs and future studies that are coming. So we have some homework to do to see if there's any additional research that we can bring into this group to look at. And then there was a discussion about the near misses. And I know that we have talked in a lot of different aspects in motor vehicle safety about those near misses and intervention and how hard they are to capture. But our group really focused in on really at least putting it out there and offering up to the group if there's any questions or solutions or ideas of having some sort of, how the motor vehicle crashes have a system where the report is coded, to have PVH being coded in those emergency rooms so they are tracked and able to be known that they exist and how they happen, instead of just saying, we don't know, because they're not collecting them right now. And if they are, there are some groups. We had Amber in our group talking about collecting near misses. It's not easy. It's really hard to get the accuracy of the information. So between the policy of the vehicle technology and the policy of how to get the near misses and talk about the overall issue, not just the worst case outcomes, is what the policy group is talking. And then we got a little into law and how to talk to and educate prosecutors and attorneys in cases, because depending on where you live, your situation could look totally different, where you may be charged, you may not be charged, and really thinking there might be some opportunity there in terms of policy. So I know we're over time, and I'm sorry I'm long-winded. Jennifer, do you have anything you'd like to share from the communications group before?
Sure, yeah, if I can
here?
take just a couple of seconds. We had a great conversation. We started by talking about Deanna's hospital program, and she had indicated that because of restricted visitation with COVID, that parents, caregivers were intentionally leaving children in their vehicles. And so they were doing more patrolling around the parking lot. And so, we talk about it being unintentional versus intentional. And in her area, living in Tucson, Arizona, where we know that our temperatures get very hot, we have these restrictions at the hospital. How can we provide that education and provide those outreach strategies? And to Dr. Diamond's point, we did talk about state policies for licensed childcare and foster care providers in reporting when that child doesn't show up to childcare, or having some type of a reporting process. So we did touch on that, and we had some other great conversation about providing education during the Red Cross babysitter education trainings, as well as AAP, and doing some local level outreach strategies. And our group couldn't necessarily pinpoint any local level strategies. So that might be, another area that we can spend some time talking about.
Thank you very much, Jennifer. Appreciate it. Can't wait to get a little bit more information from you and debrief, and I'll make sure to get that out to the group. But I know we're over time, and I just wanted to point out that our next meeting is scheduled for July, and we've been on track to meet that first week in July. So just wondering, I think I have a poll here. That first Thursday would put us at July 2nd, and just thinking that a lot of folks have vacation plans. I'm just going to throw a quick poll if you could indicate your choice. And I know that not everyone will be able to attend, and those who aren't, the recording will be available. If you have anything in terms of presentations or speakers or questions or ideas that you would like to be included in July, just reach out to me and we'll have a talk and make sure that you can get on and have some time there, whether it's within the whole group or the breakout session. So I'm going to go ahead and launch that poll. We have 27 of you. Let's see who wins. The suspense. It's getting close. We'll stop at 30 seconds here. Okay, we're gonna go say the next meeting will be July 14th, and I will send out that invite here shortly. So we had 60%, so not quite 50 or over 50-50. So we're gonna go with July 14th for our next meeting. So thank you so much. And I hope that you got a lot out of the breakout sessions. We're going to continue with these and see if the best way we can share the information. And again, if you have any ideas of folks that we're missing, or research that we're missing, or conferences that you think this would, to get other people involved in this group so we can continue our mission here, I would be happy to read an email from anyone from the group. You don't have to wait till July to hear from me. So thank you guys so much. Have a great week, and I appreciate all your thoughts and hard work on this devastating topic. And let's hope for some good outcomes the next few months. And it's when I look at everything, I'm just like, this year it may be different than what we've been seeing the past 2 years. And let's just keep our heads up and keep working on this and keep striving for making pediatric vehicular heat stroke solutions better. Thank you guys so much. I'm going to stay on for a little bit, but I'm going to go ahead and stop the recording.